we knew, again, with a data-driven mindset, we knew that it had to be deliberate and it had to be informed decisions. We couldn't have implemented these programs and these directions, if you will. I mean, we call them just basically operational directives. We wouldn't have been able to do that without having an absolute quality assurance tool for us to know that we were doing that responsibly and it was informed. Our power is in our unity, in our collaboration. Totally. Programs like these, many of our agencies don't have the budgets to be able to support them all on our own, notwithstanding that it also sometimes doesn't make sense if just this area of the region does it when we know that there could be a benefit for a larger one. So these conversations I had with Terry early on, share with me what it looks like if we had First Watch in Jackson County. Let me talk with the other fire chiefs and see if I can drum up some interest and share my philosophy, like we had talked about data-driven decision-making and how we can be smarter in how we're doing operations in coordination and partnership with our 911 center, who does do the dispatching for the entire valley. So COVID breaks. I have this conversation with the public health officials that we need a surveillance tool on it. I immediately put in a request through our emergency manager's office for the First Watch tool based on a quote that Terry had shared with me. And we, sort of waited. But the part I want to say is, I think I reached out and he and I had some back and forth. What if we wrote it like this? What does this look like? Include this, but not that, and figuring out what was the right system for our community right now. Yep. How could we get it done? And our organization, we know that the bureaucracy in getting some of that funding, we know it takes time.
Normally, sure.
And I knew we didn't have time. We knew that I knew that we needed to have this surveillance tool in play right now. I didn't feel like we had weeks. To get it implemented because our community, our responders were at risk and we needed to be able to make informed decisions about how we were going to respond folks to calls. We anticipated surge. We anticipated resource drawdowns due to unavailability for quarantine. We had to have informed decision making better than what we had at the time. I also anticipated that it would take 3 weeks, 30 days to implement a system like that. Anybody who's implemented any kind of technology knows what we're talking about. It takes a great deal of time to onboard. Terry and I had shared some conversations and I said, you know what, send me the deal. I'll talk to my board of directors, which I did. My board of directors supported us using funding from our organization and our capital contingency to get the contract written, and we'll get it sorted out on the other end. So I'm grateful for our board of directors, our community, and our organization for their willingness to put forward the steps that we needed to get this thing going in our in the entire county. I felt strongly enough that I wanted to go ask them to make this commitment, and we will get the money back. We'll get some support. It's an important tool for us, but I'm not worried about that. I'm worried about making sure we have the right tool to make the decisions that we did to be able to support our firefighters and our community, and the board agreed with that. I penned that agreement, that contract with First Watch, sent that by scan message back over to Terry on Monday. Data was flowing into the First Watch tool by Wednesday. I've never heard, it was unheard of. It was unheard of when I looked up, saw that message and came back from the First Watch team that your data is flowing, have a look at it, and let's start building the triggers that you need. Oh, by the way, we've already programmed in the Protocol 36 and the COVID-19 stuff that's been, pretty common across the fire service and the industry. Those that are First Watch customers, they've already kind of paved the way for what we knew we were going to need. In addition to that, we had built some other triggers that were really locally defined. So we call it an IDX risk patient. So somebody who didn't qualify for ProQA's Protocol 36, but had symptoms that we were concerned about, that we wanted to wear additional PPE on.
And you look at the symptom list for COVID right now, and it's hard to find something that's not on the list. Right?
It's hard to find something that's not on the list. So we had Protocol 36 patients that were extracted based on certain acuity levels or certain conditions were dispatched differently. And then we had other calls that had IDX risk. So there was a patient that we were suspected was sick with COVID-19 that would inform our officers on the best approach. Sometimes it was wear all the PPE and go in and make contact. Sometimes it was go in by phone. Sometimes it was one person with PPE and they would make a determination, call the rest of the team. There was a lot of flexibility with our officers, our captains on the engines to be able to exercise judgment on the call. We were able to use the information that First Watch was capturing in the system to provide quality assurance to the decisions we were making in terms of response. In addition to that, the tools was shared and up at the Emergency Communications Center that Jackson County Emergency Operations had operating. They were watching the trends in the 911 system. So they were able to see over time if we were seeing where our surges were at, times a day that our surges were at, all, obviously all tools that First Watch provided to inform our policymakers at that level. Public health, emergency, the IC for the county's Emergency Operations Center was seeing, the sheriff were all able to see real-time information that was going through the system. How many patients were COVID suspected, how many patients were not. We knew that from a response standpoint, we really treated every patient as if they were COVID. But from a public health hospital system and what's our capacity to manage, knowing which patients were symptomatic or not would be important. Other things that like we mentioned earlier, that we wanted to monitor was if multiple calls to an address, the high-risk facilities, that if we saw multiple 911 calls in a given time frame occurring at one of our high-risk facilities, a nursing home, that we felt that would be a necessary alert to public health.
Sure.
That we think there could be an issue, and that it at least deserves somebody to take a look at it. It could be different ambulance crews or different shifts that go there. They may not have realized there was multiple calls that had happened to that facility in a given time frame. First Watch doesn't let that through the cracks. It captures it, it sends the alert, it gets us the idea to look into it, because the solution public health may have wanted to do was move medical practitioners to that facility instead of moving people out one at a time to an emergency room. Maybe we need to bring the doctors to that facility because it's already spread through there. We don't look at problems through one lens anymore. We look at it through multiple lenses.